Thank you so much. All right, let me just minimize this so you guys can see the screen. So what we're going to be using today is something called Menti. So if you guys on your phones or if you're on your laptops, just log into menti.com and there's a code there that you can just put in. It will be on the top of every slide, which is 28164052. So once you've entered that code, you'll be able to ask questions directly onto this website. It's all anonymous. We can go through them at the end, and you can also interact with me as we go through the slides. So I don't know if you guys are all at the same level, but I assume you're all applying to dentistry or thinking about applying. So a bit about me. I applied and did my application a few years ago, and I studied in London and I went to King's. It was a little bit of time ago, but the application hasn't changed dramatically since then. So if you've got any questions specifically about that university or any of the dental schools, I'm happy to answer the questions for you. After that, I did a few different things after qualifying. So I'm going to talk about that at the end as well, just to get you a bit of a flavor of what you can do in dentistry and all the different options that are available. So today we will be talking about an introduction to applying. So this will be part one of a series of 2 webinars. The following one will be next week. And we'll start off by just talking about a few things that you might need. So just make sure you're on this website so you can interact. So in terms of UCAS, this is the website and the platform that's used for university applications. The way that you register for it, it's something that you would have been told to do if you're at school or college, or if you're not and you're taking a gap year, you might be familiar with this website. But what you can type in into Google is UCAS. This is a website. If you want the link, I can send it to you on the chat of how you can register for it. So if we just start off with the first question, you should hopefully be able to see this on Mentimeter. I just want to ask you guys what you think the most important thing for dentistry school applications is. Do you think it's the UCAT? For those of you who don't know, this is an aptitude test that you have to do and you're given a score. Is it your GCSEs and your grades that come with that? Is it your A levels? Is it your personal statement? Or do you think it's everything? So if you vote on Menti, I can see that 6 people are on it. So if you vote on that, it should come up on my screen. I'll give you a few minutes to do that. Yeah, one person's put something in. Keep going. And if somebody wants to unmute and wants to speak, why do you think what you've chosen is the most important? What have we heard? Is it based off what people have said? Is it based off what you've experienced? Does anyone want to unmute and tell me? I don't know if I can go back on the chat. I can try, but it's going to be a bit difficult for me. Let me see if I can go back on Zoom to see if anyone said anything. There we go. No, I don't think anyone has. Does anybody want to say anything, or I can move on to the next slide and tell you what the answer might be? No, I think everyone's shy. Okay, I'm going to move on. So the answer to this question is number two. So everything is important. So you might hear rumors about people saying that some universities favor the UCAT score and they have a cutoff, which is true. They might also have A-level grades or GCSE grades as a minimum that you need to get in order to be eligible to sign up to the university. But the most important thing when you're applying for dentistry is everything. So that's your grades that you've got up to this point, the grades that you're predicted, your exams that you do, like the UCAT, and your personal statement. But on top of this, there's other things like extracurricular activities, things like work experience, things like volunteering. that are also very, very important. And we've got to a stage over the years, as time has gone on, that everyone gets this bare minimum of the grades and they get the UCAT score. So it's trying to find a way to distinguish yourself from the rest of the cohort, which can be difficult, but as long as you're hitting the points of everything that's listed here, you'll be in a good position. So we're going to be talking about how to work strategically. So most of you, if you don't mind letting me know on the chat, maybe, are you applying for dentistry? Have you done your UCAT? Is it something that you're still doing? What stage is everyone at the moment? Just so
Um,
I can gauge. Oh yeah, hello.
Hi, I'm still in year 12. I'm still planning to do dentistry. So I think couple of months my school will start to do the UCAS, and then they said that the UCAT I'll do it by myself at home. So I'm just have a question. You know the UCAT, when should I usually apply for it?
So with UCAT, if you're in year 12, you'll probably get signed up in the summer that's coming up. So not now, it will be the summer of 2026. So just before that, the UCAT tends to be either it starts in July or it tends to be July, August, and September. It might be August and September. So it will be the summer of next year, and you sign up just before that. And depending on what area you live in, it might not be necessarily done at home, but it might be done at a computer center. So if you've had a driving theory test before, you usually do that at a center where you work on a computer and you do it. So that might be the case, but I'm not sure. Depending on which area you live, it might be done at home. But it's something that you register for your own. Like, your school won't do it, like you said. You have to do it independently, and you go and sit the exam and you organize it yourself. But it will be in the summer.
Oh, okay.
Hope that answers your question. Perfect. So a lot of you have answered. So I'm just going to go through what you guys have said. Someone said GED. I don't know what you mean, if you can clarify that. Someone else is in year 12, starting year 12. He's talking about graduate entry, maybe. I think it's graduate entry dentistry, possibly. Yeah, cool. Um, so you'll definitely be familiar with the UCAS. Year 13 just on the UCAT. Okay, so you're all at different levels and different stages, but just being aware that to get into dentistry, you do need to do the UCAT. You will need to write a personal statement. You will have an interview. So there's quite a few obstacles that you need to get through before you actually get your place. But it's working strategically. So depending on where you are, if you're in year 12, it might be thinking more about things such as work experience, trying to organize that, trying to get varied work experience in a dental practice, maybe in a hospital, in different types of settings, and maximizing that. If you're in year 13, it might be working on your A levels, and if you haven't done the UCAT yet, it might be preparing for the UCAT. So it's just trying to think about where you are in the stage of your application to try and maximize what you can get out of it, if that makes sense. So there's different types of systems for universities depending on where you want to go. People talk about UCAT cutoff scores, which is the case for certain universities. Sometimes it's rumored that certain universities have what they like to have students get. So they might say, most of our students that we accept for interview get a score of 700 and above. Now, this can fluctuate and depend on each person. So, if an individual had a slightly lower UCAT score, but their grades were higher or their personal statement was more impressive, the rules might bend a little bit depending on there. So just be aware that there are cutoff scores, and for some universities that is true, but in others it might just give you points and then they might give you a waiting list created by that, which is what point two says. And then in some cases they might look at the UCAT in collaboration with your grade. So then they might put those two together, assign you a score for each, and then rank you. So there's different ways and different things that universities will do. So what we do as part of Study Mind or Medic Mind, if you wanted to have a look, is we help with just providing more information about applying to university, whether that's just asking questions about particular universities, as a lot of our tutors have studied in different places or are at the moment studying in these places, so you can get more information about what it's like to study there. There's different courses that are available, and if you want some more information about it, there's a link at the bottom which I can put into the chat, or you can take a photo of it and type it into your search bar. And for the people who've attended the webinar today, we're doing a little discount code with UNI10, where you'll get 10% off either of these courses, and it can give you some more information about these universities and what they're looking for. What I really struggled with at the time of when I was applying is some of you might have a particular university in mind that you wish to study at. You might not mind, and you might want to go to a range of different universities. Often, the websites of these universities do provide information that you can use and try and learn from what that university is offering you. But you don't always get that insider information. It's often missing from these sort of websites or the open days. So you can use these methods if you would want to get some more information about it. And you can scan this code as well if you want. I think it will take you straight to the website if you're not able to take a picture of the one before. But I can go back to this at the end, so don't worry. So a big change to UCAT this year. For those of you who've done it previously, you'll probably know there are different sections of the exam, and it involves things like a section on verbal reasoning, which is similar to comprehension. There's decision making, which is lots of different puzzles that you do. There's quantitative reasoning, which is more of a maths section. And there's also something called situational judgment, which asks you some more clinical questions. There used to be a section, so when I did the UCAT years ago, there was a section called abstract reasoning. And for those of you who have been practicing or have done this exam before, it's where you're given shapes and you have to figure out what's next in the pattern. So quite a significant change with the UCAT body is that they've removed this section for the exam. So for those of you who are sitting the exam this year, you might have noticed a change, and the results might also differ because that section has been taken out. For those of you who are in year 12, you're probably not going to be bothered by this much because it will be a year on from when it was first introduced, but this is the first year of when it's been taken out. So when you're practicing for the UCAT, if you look at old past paper questions, just ignore anything that talks about abstract reasoning. Okay, so the next thing we're going to go over is how should I pick my universities? So those of you who are here today, do you have any universities in mind of where you'd like to go? You can again unmute yourself and answer the question about why you would like to go there or what you've heard about it, just so I can get some more information of what kind of advice I can give you as well for these universities.
I want to go to University of Exeter or University of Dundee.
Mm-hmm.
Um, I really want to go there because I feel like I feel like I like the environment there, to be honest. But it doesn't matter for me any universities I want to go. I just like I want if I want to go, I want to like get out from there as like a dentistry. But also like when I have like some friends like the older than me that went to University of Exeter and they said it's really good environment and the teachers are really nice. So that's why I'm really interested in that.
Yeah, really good. That's a really good point to say. And what you've just mentioned there is important. So for those of you who didn't hear, is was it Myra? Sorry, I just saw your name in the corner. Hopefully
Yeah.
that was you. Yeah. So what you said is at the end of the 5-year program or however long the course is, you want to end up being a dentist. And the good thing about dental schools and professions or courses like dentistry and medicine is it doesn't really matter which university you go to because at the end of the course, you'll all qualify and get the dental degree, which will make you a qualified dentist and will make sure you're equipped with all the knowledge and the skills that you need to practice dentistry once you graduate. So an important thing here is that all the universities that offer dentistry as a course are very, very good and they provide you with all the skills. But there might just be one university that you want to stay at or want to go to based on your location. So if you're from Dundee or if you're from Manchester, Leeds, London, you might want to stay close to home, or you might just fancy moving to a different city like Bristol, and you might pick it based on that. So, how you pick your universities is a very personal decision and it depends on lots of different factors. For me, it was based on location, but it was also based on what the university had to offer. So I really wanted to go to a university that had early exposure to patients, which my university provided. Not all universities will have that, so it's important to check on the university website or asking questions today to try and find out how early that might happen. That was one of the things. The location, like I said, was important because I wanted to stay in the city that I was from. And I quite liked the social aspect of what London provided, which a lot of cities do. And I like the fact that King's was the largest dental school. And it's sometimes nice to go to a bigger dental school because you get to meet a lot more people and you get to mix with people from different backgrounds. There are smaller universities and some people prefer them because you're then in smaller knit groups when you have your lessons or your tutorials or your lectures, and some people prefer that. So it's determining what is favorable in your case and then deciding based on that. I'm just going to open the chat just to see what you guys have said. Okay, I don't think anyone else has answered. Oh, someone has. Okay, so Sarah, I don't know if you want to unmute or those people, even Alina, both either of you, if you want to unmute and say why you're thinking these universities. Or you could put it in the chat if you want to. Okay. All right. So I have you applied before? I'm not sure if you've. Okay, sure. So yeah, it's important that if it's something that you've been wanting to go to, you've tried before and you want to try and get in, that's a good idea. It is very challenging to get into certain universities. I mean, just applying for dentistry in its own is a very competitive course. So regardless of where you're applying, it will be challenging. But if you've tried it and you want to try again and see if you can get in this time, that's really good and it's really encouraging, and you should maintain that motivation. But don't be disheartened if there are things that you just need to improve on and change for the next time, which I'm hoping you would have done in the previous year. See the chat again. That's okay. I would like to live in a big city like London. Yeah, so you've mentioned the QS rankings. For those of you who don't know what QS rankings are, they are rankings of universities based on the course. So if you Google best dental schools in the UK, it might bring in the ranking of the different universities. The important thing with this is with the rankings, it's a bit of a sticky one and a bit of a strange one because they do have these rankings, but it's really hard to know what really is the best dental school because maybe Queen Mary might have had a high ranking one year and then the following year it was ranked further down on the list. That doesn't mean it's a bad dental school. It just depends on what the rankings are based on, and that might not necessarily be the student experience or the undergraduate teaching. It might be the research that the university offer and do, and that might put them at a higher position. So I wouldn't just focus on the rankings because from my experience, I know dentists who've qualified from all the universities, and when you meet them, everyone talks very highly of their university that they've gone to, and I've not heard a bad thing about any of them. So they're all very, very good. Myra, I think you've raised your hand. Do you want to say something?
Yes. Also, I was like focusing more on universities that they don't really focus on GCSEs because of my GCSEs. I got an English language grade 4, but I know they would like grade 6.
Mm.
And for math, I got a 5 as well, and they wanted a 6. So I was planning to reset them this summer. Also, but like I'm also like had like a medical condition before like my GCSEs that affected me. So I wanted to ask you if I put that in my UCAS application, would that lower my requirements of my GCSE? Because I'm planning to reset English and math anyway. So
Yeah, so in terms of mitigating circumstances, sometimes there is a section on UCAS that you can put it in. Now, the university might take that into consideration, especially if you believe that might have harmed or affected your grades. The fact that you're retaking them is really good because even if you didn't get the grade you wanted, at least you're giving yourself another chance to do it when you're feeling better as well. But if there is an option where on the UCAS application you can put it in, I would encourage you to do that. I can't tell you for sure, and I can't guarantee that it will lower your entry requirements because that will be the discretion of the university. There are some universities that might look at it and say, actually, this person has tried really hard and done things in other areas and met the requirements there, so we can lower the entry requirements for this specific thing. However, some universities are super, super competitive to get into. And in those cases, if they are very oversubscribed, they might look at the mitigating circumstance, but they might not necessarily be able to modify the entry requirement. So I can't promise it, but if it gives you the option, I would say it's a good thing to do and be honest about it as well. I hope that helps.
yeah, thank you.
But that's a really good point. So if you've noticed that a university wants you to have a particular grade in a subject and you don't have it, then you might not want to apply to that university to maximize your chance of getting in. So if you know that Queen Mary or Dundee or Leeds wants a high score or grade in English or maths and you don't have that, maybe look at another university that doesn't have that as a outright requirement. That would be very important. So I'm just going to go through an example of Belfast University and what they might include. So I'm just going to flick my screen over to this and hopefully you can see this policy. So all the universities should have this. It might not be called admission policy or a statement, but it might, if you Google a certain university like King's and you type in entry requirements, they either will have a PDF document like the one I'm looking at right now, or there might be a website that provides entry requirements and information about the way that their course is structured. So it's an important thing to look at when you're deciding which universities to apply to. So if we have a look at Belfast, so this is the entry of 2026. So for those of you who are currently in year 13 or you are in taking gap year, done a degree and you're applying this year, so in September, October, this will apply to you. So if I just flick through this, you will see there's a lot of writing. We're not going to go through this today and I'm not going to get you to read it all through today, but you can always look at this in your own time. But just looking at this first page, it talks through when the deadline is, which is the 15th of October at 6 p.m. We always advise to submit your UCAS application early rather than leaving it too late. So when I was doing my UCAS, I submitted mine, I think, at the end of September. Your school might have its own deadline requirement, so make sure you have a look at that so you know when your internal deadlines might be. So there's some more information about how it's structured. They talk about the selection program, the selection process and what they look for. They look at academic performance. They look at the UCAT, so that's up there. Sorry, you might not be able to see it. UCAT, and then they'll do an interview where they'll test you on a series of different things. So if we look into the UCAT and we look at what they look for, so it talks about what the UCAT is. So for those of you who don't know, it's the University Clinical Aptitude Test that you do in the test centre, and you get your score given straight away as soon as you finish. So if you have a look at that, some universities will put you in a decile based on the results you've got. So there's a banding system and they put you in percentiles. So as you can see on this table, if you're in the top 10%, you'll be scored the highest. So that'll be 9. And when the UCAT comes out, it also releases eventually. It comes out a bit later. So it says here, the centiles and deciles are published after testing ends. So if you sit your exam now, you'll have to wait until all of the tests are done by the end of September or mid-September, and then it will tell you roughly which centile you're in. And if you know you're on the 70th or 80th centile, you'll know you get 7 points for this university. And if you're in the higher one, you'll get 9. And if you're in the low centiles, you'll get 0 points. And it's just being aware of how many points you think you might need to get in. So if I zoom out of this again, so it says for home fee candidates, so it differs between international and home students. So being aware of that if you're international, there might be a borderline combined score that they use. So if somebody gets the same score as somebody else, they might be put on this borderline system where they might take something else into account. So that's something to be aware of as well. Myra, you asked about the exemption. So this talks about exemptions to do with the UCAT. So it's just being aware of what this says and what they mean by if there are any, what they would accept as a mitigating circumstance. This is only for the UCAT though. Okay. Talks about the personal statement as well and what that university might ask for. So generally things are an interest or passion for dentistry and explaining exactly why you want to go into it. Having the necessary work experience criteria met, so either spending a week, 2 weeks. Some universities might say you need 2 weeks signed off, so making sure you have that, and doing some extracurricular activities as well. This also talks about A-level requirements. So some of you might do the IB, some of you might have a degree, you might all be doing different things. So being aware that here it says you need 3 A's at A level and you need to do chemistry and biology. So those two are necessary. And for GCSEs, you need a C or a 4 as a minimum. And then it talks about school leavers completing A levels for the first time in 2026 because the grading is changing. So being aware of how many points you'll get based off what you've done. And it talks about here, this is the scoring system for when you did your exams as well. And then it just talks about different types of things, like pathway, different types of entry, which I'll talk about at the end. Lots and lots of writing. You don't have to go through all of it. But you can have a read at the end. What's really nice is some universities will have a table which will summarize everything. So if you're like me and you like everything summarized on one page, this is quite a nice table you can take a picture of. And it goes through what the requirements are. So this is for the UK and the Republic of Ireland. And there's some more writing here, but you can definitely find this, and if you want it, I can send it on the chat. And there's just some more information. So for the person or people who mentioned about graduate entry, it talks about that as well. So you might need a 2-1, for example. It talks about international students and English requirements as well. So that's that example. I think somebody asked a question on the chat. Which bit do you want me to summarize? Sorry, I didn't see this message earlier. Okay, so that was the first example. The second example I'm going to use is Newcastle. So if I flick to my next page here, so this is the Newcastle entry information. So it talks about, they're quite honest with their information that they've given you. So it talks about from 2019 to 2023, how many applications they got and what the UCAT cutoff score was. As you can see that applications are increasing in number. It dropped slightly for 2023, but I assume it's just going to be increasing as the spaces increase as well and the demand for the course increases as well. So it talks about how many people applied and it talks about what the UCAT cutoff score is. It does fluctuate. So it was 2548 in 2019. 2020 uh went up slightly to 2560 and then went up again 2740 and it keeps changing. So being aware of what their threshold and cutoff is going to be. And some universities will have a cutoff, and it says here that the threshold will change every year. They're not able to give you one and predict one because it will depend on what your cohort has got. So if your year group has got an average of a certain number, then they'll base that cutoff on what your year group got. It won't be based off your last year or the year before. It will be very current because they need to make sure they're being fair to what this year has got. So that's what that's talking about here. Let me see what the chat said. What does cutoff score mean? So what a cutoff score means is you'll get your score of your UCAT, and some universities will have a minimum score that they will require for you to apply. So if the cutoff score for this year is 2,600 and you got 2,400, then you wouldn't be secured an interview because your score is below their minimum, if that makes sense. Is that okay? Does that answer the question? I'm hoping it answers your question. Let me know if it doesn't. Yeah, perfect. Cool. So that's what we mean by a cutoff score. Just like they might have cutoff grades, UCAT is something that some universities will say we need a bare minimum of this score. So if you don't have it, I would not encourage you to apply to that university because then it's a waste of an application for that university. If any of you are resitting your A levels or resitting your exams, just be aware of what the requirements for the university are. So if biology and chemistry is a requirement and you've not got that grade, just make sure you check all the universities and make sure that the grade that you're aiming for is what the university will require. And if you're taking a year out to resit an exam, think about what you could do in that year. So, can you do some extra volunteering? Can you do some extra work experience? Is there anything that you could be doing while you're revising in this year to make sure you're in the best position when you're trying again? It's okay to resit A levels. It's okay to have to do these exams again. Obviously, it's not anything that we want to have to do because these exams are very, very tough, and doing them once is very challenging. But even if you have to resit an exam, doesn't necessarily put you at a disadvantage to somebody else who got in the first time. But it's just ensuring that you're not losing your motivation, being aware that yes, you've done everything else, but the grades will be important and you will be able to get them as long as you work hard and strategically, which is what we've been talking about today. So, what do we think about this question? Should I take a gap year or have a backup choice? What are we thinking on the chat? So, let's imagine we're applying to dentistry this year. We're not sure if we'll get in. Do you think we should take a gap year? Do you think you should have a backup? What do you think your position is on this question? Yeah, so why do you think you should take a gap year for those of you who've said? Yeah, to gain more work experience. Yeah, that's true. Anything else? And Myra, if you've said backup choice, what do you mean? What would your backup be?
I did the research that you can go like into foundation. What I can't remember what it called, but it's like a foundation year in dentistry. And then if the uni think that you did really good in that, then you can change the path and then do the dentistry. I think it's called dental hygiene and therapy. I think. Well, that
Okay.
was
So
called.
dental hygiene and therapy is a different course to
Yeah.
dentistry. So with that one, when you finish, it's a 3-year course. You won't be a dentist at the end. You'll either be a dental hygienist or a dental therapist. So that would be an alternative career path. And it's not necessarily something that you can convert or switch to. It might be something that some universities might offer, but I haven't heard of one myself that does that. But a backup option could be either you change what you want to go into. So if you can't get into dentistry, you might think, actually, I don't want to do it. I want to do something else. So you apply for that. You might apply for biomedical sciences or something a little bit different as your fifth choice, which you can put down. So when I applied, I did 4 universities for dentistry. And then I had the option of doing a fifth choice, which couldn't be dentistry or medicine, but it had to be something like biomedical sciences. So that's what I put down. So it really depends on you. I don't know what I would have done if I didn't get in. I don't know if I would have taken that offer of the biomedical sciences or taken a year out. It really depends on how much you want it. And if you think that taking a year out will help you and will get you the stuff that you don't have right now, then I would say take a gap year. But if you're not bothered and you don't mind doing another degree, which you can do as some of the people on this webinar have done, you can always do another degree like biomed or applied medical sciences, something like that. And then once you've done that, you've got a degree already, and then apply for dentistry. So it's a longer pathway, but if you've got a degree already, sometimes you can do a shortened dentistry program. So that's also an option that you have. Um, Always have a backup choice, but a gap year is a good option if you meet the requirements and reapply or wish to reset A levels. Usually a good choice if you miss. Yeah, so if you've missed your grades, you can. Um, but I would say having a backup is always good. Um, Being aware and always, regardless of if you get in or if you don't, on your journey of even when you're a dentist, even where I am right now, it's really important to keep your options open and always have a backup because you might not always get exactly what you want. You might get close to what you want, but it's always good to have something else just in case your plan A doesn't work out. So, what are the alternative routes into dentistry? So, I've mentioned one of them where you can do any degree really. If you do more of a medical one, it might put you in a better position, but you can do things like dental materials, that's a degree you can do. You can do biomedical sciences, applied medical sciences. So, doing any of these degrees, there's a lot more on the list, but you can do these and then apply to dentistry. You can take a year out and get your grades correct, get your UCAT score higher, get more work experience, and then apply. It is difficult to transfer between programs, and I wouldn't really recommend that, but that's something that if you've heard about, maybe do some more research into it. There is graduate entry dentistry, which I've mentioned, so doing a degree and then doing a shortened dental program. If you've done a degree like medicine, and then you're doing dentistry, there's again a shortened version of the dental program. For some people as well, there is a longer course, so a 6-year course instead of 5. And this is generally offered to people of certain backgrounds in certain schools, just to increase the opportunities. So just having a look at that, it might be just called a foundation entry program. I think that's what Myra was mentioning earlier. So that's another entry into dentistry as well. Okay. I've ended the slide here about alternatives. What we're going to go through now is just a Q&A, maybe for 10 minutes or 15 minutes or so. So what I want you guys to do on Menti, so what you've been using at the beginning, is just put some questions onto there rather than the chat, just so I can see it easily and then everyone can see what the questions are. It's all anonymous, so you can ask anything here, any questions you have about the application, about any universities, or if you have any questions about what I've said today, I can repeat it and go back. But feel free to put in any questions on there and I'll do my best to answer them. I'll give you a few minutes to do that. I'll give a few minutes and then I'll answer the question. So keep going. While you're asking questions, I'm just going to talk you through what I've done so far as well, in terms of the different career pathways you have when you're a dentist. So I qualified from King's, like I said, and then I did a year of foundation training, which is where you work in practice in a high street dental practice, which you have to do once you qualify, and that was in the NHS. In practice is where I saw and did a lot of routine dentistry, which means your day-to-day checkups, fillings, taking teeth out, so extractions, root canal treatment. I made dentures, I did some hygiene appointments, so things like that. I then worked in hospital for 2 years and I worked with children for a year, so I worked with very unwell, poorly children who were referred to the hospital to have treatment done. And these were more challenging cases that I got to treat and oversee. I then did a year in oral and maxillofacial surgery in a hospital as well, um, where I was involved more in bigger surgeries for patients that might have had things like skin cancer or issues with their joints of their jaw. So that's what I did then. And I'm now working in a community setting. So I've worked in practice, hospital, and I'm about to start working in community. So when you're in dentistry, there are different paths that you can go down, and you don't have to stick to that. You can always change it. You can always do a combination of them as well. And once you are a dentist, you can also specialize. So dentistry is quite specialized in itself, but if you like a certain type of treatment, you can specialize within that and then offer it to a higher standard for your patients. Okay, I'm going to start answering some of these questions. I've got four on there, so if you've got any more, feel free to send them on the chat before it ends. So the first question is, what type of volunteering or work experience do you recommend? So for volunteering, as the first part of the question, I would recommend things like a care home or like an elderly home where you can go and speak to patients or residents, should I say, and just trying to learn how you might have to adapt your communication for this group. Because when you're a dentist, you'll be seeing patients from all backgrounds, all ages, from very, very young to older. So it's being aware of whether or not you're able to do that. And everyone is able to do it, it's just learning how to do that better. So you can do that. You can volunteer in hospitals by providing meals to patients, or even giving tea and coffee or being there for well-being. You can volunteer in a charity shop or volunteer as part of a charity raising money. That's something you can do. With work experience, I would recommend definitely getting high street dental practice work experience. So whenever you guys go for a dental checkup in the high street, like your normal one, getting work experience there because that's where the majority of people will work once they qualify. So seeing what a dentist does on a day-to-day, asking questions and seeing what it's like to live in the day of a dentist, essentially. I would also recommend if you can, it's quite tricky to get hospital work experience, but I think it's important because it shows you a different side of dentistry and shows you the more complex cases, which I find really interesting. So I would recommend you do that. If you're interested in medicine and you're not sure if you want to do dentistry, maybe doing some medical work experience might help as well, bring an extra layer. Because even though you'll be applying for dentistry, it's important to be aware that even as a dentist, you have to be aware of a patient's medical background. So that would be good. Other things you could do is also go to a dental laboratory. So a dental laboratory is where they make dentures, where they make crowns, where they make bridges. So seeing the process of what happens between when a dentist sees a patient and then when it goes out to the lab and how they make what they make. So that's what I recommend, and I hope that answers that question. Next question is, would it be okay to do all of the work experience in a gap year? So I would say I wouldn't leave it to the gap year to do it all because there's no guarantee that you'll get the work experience you need all in 1 year. If you can, I would start now for looking for it and try and do bits as you go along rather than just cramming it all in one. Um, Work experience is always oversubscribed, and a lot of people will be applying regardless of what stage you're at. You might be thinking of doing it then because you've got more time. But I would say even when you've got holidays, if you're at school or college, you should maximize those holidays and use it during that time. That's what I would recommend. What do you need to do after initially graduating with a dental degree before you can work as a dentist? So, as soon as you graduate with a dental degree, you are a dentist and you're working as a dentist. So, once you've got your BDS degree or whatever degree you get, you are a qualified dentist. And as soon as you finish, you will be registered on the GDC, which is the General Dental Council register, which means you have the license to practice as a dentist. When you graduate, if you want to work independently as a dentist privately, you can do so. But if you want to work as an NHS dentist, you need to do a minimum of 1 year of dental foundation training where you work in a practice and you might have a supervisor who oversees what you do. In that year, you need to do a certain number of treatments. So you need to take a certain number of teeth out, certain number of root canal treatments that you have to do, and you have to do a presentation as well. So it's more of a training job. They are changing this as well. So at the moment, it's 1 year that you have to do. They might change it and make it a requirement to do more years because at the moment they're trying to retain more dentists in the NHS rather than getting them to move on and do private work. So there's a long way to go before thinking about what's going to happen once you graduate, but that's just a flavor of what you might be doing. And then you can go on to work in hospital should you wish, or you can work in practice, or even in the community. Is English Language 4 and Maths 5 GCSE important to unis? Let's say I scored high in A levels and UCAT, but I got 6 in chemistry, 6 in physics, and 5 in biology and GCSEs. Do I need to resit biology? So again, this will depend on the university. Some universities have very strict rules. So if they say they need it as a minimum requirement. So like the cutoff I was mentioning for UCAT, it might be the same cutoff that you have for universities for the grades. So if they have it, I would say stick to it. Sometimes, if you've done better in other areas, and I stress the sometimes, they might bend the rules and give you the option of a lower requirement. But this isn't very common and it really will be a case by case basis. So, in the sense of do you need to resit, I would check it against the university you're thinking of going to. If you're really passionate about that specific one, then it might be a consideration of resitting that exam. How would you specialize in cosmetic dentistry? So, cosmetic dentistry isn't a specialty of dentistry itself. It's something that is done privately when you're a dentist. So, when you become a dentist, you might be doing some courses yourself that you pay for independently. So, you might go to a course that's run by a bunch of dentists, and they might teach you how to deliver better cosmetic dentistry. For those of you who don't know what cosmetic dentistry is, it's when you're improving the aesthetics or the appearance of teeth. And that might be through whitening, it might be through fillings, through crowns, and it's to improve the smile and the way it looks. So it's not necessarily a specialty in itself, but it's something that you would offer privately. And you can either offer it or you can do some courses to train yourself. Hopefully that answers that. Would you need to do another degree to be able to do cosmetic surgery? So if you're talking about cosmetic dentistry, you don't need to do you don't necessarily need to do another degree. You might do courses like I mentioned. They do have degrees in it, so they might have aesthetic dentistry as a degree, but that wouldn't make you a specialist in it because it's not a specialty on its own. But there are diplomas and things like that that you could do. That would give you extra knowledge and skills. But that's for much later. I think that's all the questions. Does anybody have any more questions that you want to go through or anything else you want me to repeat based off what I've said? I know we finished a little bit earlier, so there's still some time if you've got any more questions. I'll just double check the chat in case any of you have asked me anything. Or even if you want to unmute and ask a question, that's okay as well. Anything about the application, anything about universities, anything that you didn't understand about what I went through. Let me just make sure I've gone through all of the questions. Are we happy? So this is part one of a series, and we're going to do another webinar next week as well, just to go through the application in a bit more detail. Feel free to put in the chat what other information you might want addressed in that next webinar. Oh, someone's just asked me another question. When and how should we start preparing for UCAT in, do you mean in year 12? I'm assuming, yeah, in year 12. Okay. So I would say you won't be doing your UCAT for a while. You'll be doing it in summer. Um, you can maybe start slowly preparing, but I wouldn't say to do any questions just yet. You can just start reading about the exam and what it offers and what it contains, what the different sections are, so you're prepared. And you can look at our website as well. If you type in Medic Mind or Study Mind, we have lots of question banks that you can use. And we also offer courses to help with UCAT as well, just to give you some more advice and some more knowledge that you can use. But I wouldn't start practicing the actual questions yet because you can start revising too early for it, and then you might peak too early before your exam, and you want to really be peaking, so getting your maximum scores at exam time. So I wouldn't start too early, is what I would say. I think we've got another question. Hold on. What unis do not like when they see what unis does not like when they see in sorry, is this like what do they not like to see in a personal statement? I think that's what the question's asking. So, oh, personal statement should generally have the following things. So, one thing should be showing and showcasing your passion for dentistry. So you should have that in your introduction and your conclusion, but also it should be showed all the way through. There should be a section on the work experience you've gained and done and achieved, but not necessarily just stating the work experience, but it's talking about what you've learned from each work experience you've done. So it might have been a simple thing of a dentist talking to a patient, but what did you learn from it? What did you like about it? How did that change your opinion of what it's like to be a dentist? So they want to see more of the reflection side. They don't want to just see you listing stuff you've done. You should have a section about your extracurricular activities, so things like volunteering, any sports you do, any instruments you play, things like that should come under that section. And then just putting in anything else that you think might apply to what a dentist might need. And they don't like it when people lie, but I think that's an obvious one. So being honest, because they will ask you about it. What makes good UCAS stand out? So with UCAS, the good things are, and what will make your application stand out is your grades. So if you've got the good grades, your application's already at a good foundation. Your UCAT score again, that will be a good foundation. But your personal statement, I would say, is also very important because they're not going to meet you until the interview. And if you want to be chosen for an interview, you need to be impressive or impress them. So in your statement, explaining why they should choose you. So what experience do you have and what have you done that makes you a good dentist or could make you a good dentist? And why should they offer you the chance to have an interview? That's what I would say. What book would you recommend to read? So with dentistry, there aren't many books specifically applicable to it. What you can read about is NHS dentistry, the hot topics of dentistry, what's in the news. That's the sort of thing that I would read. You can also read about the history of dentistry because you'll see a lot of patients now that are quite fearful of going to see the dentist. And there is a book, I can't remember the name of it, but it talks about what dentistry used to be like many, many years ago. So you can possibly read that, and that might give you some more information about what kind of things they might have experienced before. What kind of questions do they ask in the interview? So this could be a whole webinar in itself, which we'll probably be doing later on in the year once interviews start coming out. But a quick overview is they might ask you why dentistry, why have you picked the subjects you're doing at A level? If you've taken a gap year, they might ask you what you did in the gap year. They might ask you about your work experience. They might ask you what skills you have and how they apply to being a good dentist. So they could really ask you anything, but they'll try and connect it back to the dentistry course. Okay, I think that's the end of the questions. So thank you all for being here and for listening. I'd be very, very, very grateful. I've done a very quick feedback form. So if you don't mind just spending it, just going to take you 2 minutes. If you can scan this QR code for me, it should take you to a Google form. And it's just a few questions about the webinar today, about how you found it, how much you knew before and after. It's all anonymous, like I said, and you can just drop a comment at the end of what you liked about today and what you would like next time as well, just so I can adapt it and tailor it for you guys next time. So I'll just leave that on the screen for you so you can scan it, and I would be very grateful if you could fill it out for me. I'll also be doing the webinar next week, so if you've got any suggestions for me, you can put it in that Google form and I'll review it once you guys have filled it out. I'll just have a look at the chat. Perfect. Thank you. If you just spend just 5 minutes, I'll just stay on Zoom as well. If anybody wants to ask any questions, I'm happy to stay back a couple of minutes just to answer them. I'm sure you guys also want to go back and enjoy your Sunday evening before you start the week tomorrow. So thank you all for being here and look forward to seeing you all next week as well.
Thank you, everyone, and thank you so much, Julika, for today. Enjoy the rest of your evening.
Thank you.